general management and ways to consider looking at how to handle different types of infections. Again, the first thing you need to look at is what type of infection is the individual dealing with. Again, are you talking a bacterial infection, a viral infection, a fungal infection? Because obviously that's going to dictate what your next step is in as far as what type of medication or just how you're going to treat in general. Look at the drug allergies that the person may have. For instance, penicillin being a very common antibiotic that people have allergic reactions to. Again, we talked about if it only causes a rash, they can be given a cephalosporin as a substitute. If it caused an anaphylactic reaction, then they can't really use either one, and you need to start to look at utilizing a different type of antibiotic. You can't use either a penicillin or a cephalosporin in that situation. Compliance with taking the medication is going to be very important. You know, we had discussed, you know, the issues, making sure that the medications get taken in their complete form throughout the course of treatment. They find that if a medication can be taken once versus twice a day, there's typically better compliance, which would make sense. The less you have to take a medication, the more compliance you're going to have. And, you know, make sure that there's no particular issues related to athletic performance. In most instances, when you're looking at the medications themselves, there's not a whole lot that would preclude from athletic performance. When you're looking at the infection in general, again, typically if the person's going to have a fever, they should not be competing. If they usually just have some symptoms, they say do the neck check. If you've ever heard of that, symptoms above the neck, if they just have kind of like a runny nose, a little bit of a scratchy throat, no fever, they're usually okay to commence activity. If they have symptoms below the neck, a lot of chest congestion, with a fever, they should not be competing. And a fever will contraindicate activity because of the potential for other issues to arise. So those are some issues to kind of look at as they relate to athletes in competition. So now here we're going to look at topical preparations for infections, so get a little bit more in-depth. We're going to be discussing some things that aren't necessarily in your textbook, so make sure you're making some notes here on your note sheets and just being aware of some specifics of some of these different types of topical preparations that we're going to be looking at. So the first type of topical we're going to look at are what are classified as antiseptics. These are different types of formulations that are applied externally, and the idea is they stop the growth of microorganisms. They use disinfectant-type chemicals to destroy the microorganisms. There are many different types. The thing to be aware of is there are some antiseptics that can actually inhibit wound healing, and we're going to talk about some different types of antiseptics and those that are both irritating and non-irritating to wounds. Ideally, you want to use non-irritating antiseptics. So again, be mindful of when you're using certain types of topical antiseptics, and a lot of the antiseptics that get utilized that are very common to be used, a lot of times will inhibit wound healing. So it's important to use some updated information when you're treating wounds to make sure that you're not damaging wound beds and limiting the healing that take place. So the antiseptics and dosing, the big thing is when you're looking at wound care, okay, because it's primarily what we're looking at with dealing with trying to clean wounds. Cleaning with soap and water is really all you typically need to do to thoroughly clean a wound. Again, a lot of the antiseptics are actually going to destroy the wound bed and cause some inhibited wound healing. So clean it with water and soap, or even a sterile saline solution is really all that's needed. Some of the different types of over-the-counter antiseptics that can be utilized, you have acetic acid, you have your alcohols, chlorhexidine, which is HebaCleanse, and a lot of times they will recommend utilizing HebaCleanse to prevent MRSA infections in wounds. hydrogen peroxide and iodines. A lot of these, again, are irritating to the wound bed. Particularly your alcohols, hydrogen peroxide, and iodines are actually cytotoxic. In other words, they will actually kill the cells that are utilized in healing. So while they will destroy any type of microorganism, they'll also injure the wound bed and limit the healing. Now, I mean, again, all wounds will heal in time, but ideally, you know, when we're dealing with individuals with wounds, we want those wounds to heal as quickly as we can. So soap and water, and again, a sterile saline is really a lot of times all you will need to make sure you keep a wound bed clean. If you do choose to use a different type of antiseptic, you just have to understand that the wound healing won't happen quite as fast. The advantages of using a topical are obvious because you're not going to be getting the systemic reactions and or side effects that you would get for instance, with an oral antibiotic. So it just kind of focuses in on the area that it gets applied to. You want to make sure that you use only on small areas of the skin, so you're probably not going to be using topical antibiotics on very large, deep wounds. So this helps avoid any type of systemic absorptions and any possible toxic reactions. Every antibiotic, just as with the oral antibiotics, has a specific range of bacteria that can be treated. So the more active ingredients they have, the more effective they are against a wider range of bacteria. And this is a lot of the reasons why when you see one of the more popular types of topical antibiotics are what is referred to as a triple antibiotic. So they actually have 3 different antibiotics within the topical preparation, and it just makes it a little more universal to a lot of the different bacteria that could get into wounds. And sometimes these will also be combined with anesthetics, which, in addition to then helping with reducing the bacteria in the wound, you can also help reduce some of the discomfort that is caused by the wounds. So as far as dosing goes with topical antibiotics, you could a lot of times just simply start with soap and water for most wounds. Again, I also had thrown out there using a sterile saline can be very beneficial as well. And again, the benefit of that is you're going to clean the wound, and in addition to that, you're not going to apply anything that's toxic to the healing cells in the area. So you want to make sure you keep wounds moist for healing. And in a lot of instances, you don't even really necessarily need an antibiotic for a lot of your wounds. So again, soap and water and keeping it clean in a lot of instances are your best bet. If you're going to choose to use a topical antibiotic, small amounts for not more than a week, unless a physician feels it or deems it to be necessary, and you want to use the topical antibiotic 1 to 3 times a day. So some of your different types of topical antibiotics, bacitracin is a very common topical antibiotic. You have your neomycin, polymyxin B, which is used in combination products, and I have some other combination products on here. Neosporin is a very popular over-the-counter topical antibiotic. Again, both Neosporin and Polysporin are basically combination products. They have multiple antibiotics. Sometimes you'll just see in generic form, you'll just see triple antibiotic, and again, that's just the different types of antibiotics that are combined. Again, it just kind of helps with working on a range of bacteria that could possibly be present in wounds. And again, just note the mechanisms of action, which were discussed earlier with the topicals. With any type of superficial skin infection, and we're going beyond wounds here, we're going to look at fungal and viral infections. you have to note obviously what the cause is in determining what type of medication will be used to apply to it, and also consider the typical presentations. This could help in identifying a lot of different types of superficial skin infections. And again, prevention and treatment are important. Prevention, I mean, when we look at particularly contagious skin infections, some very simple procedures that could be followed, most of them involving sanitary practices and things like that could help with prevention. So, I mean, that should be something that's always in the back of your mind as an athletic training student and as an athletic trainer, because prevention is the biggest aspect of not allowing these superficial infections to become big problems. And then just noting your treatment and being compliant with the appropriate treatment after the diagnosis. So again, important to kind of understand your cause. So when you're looking at your superficial infection, just an example, drugs used to treat infections caused by molds are not as effective against those not effective against those caused by yeast. So it's important to note that with, for instance, your different fungal infections, to make sure that you're using the appropriate type of drug to treat it. A lot of drugs that were originally used to treat yeast infections were only available by prescription, but now they have been granted over-the-counter status once they decide to put specific warning labels on the products. And remember, we talked about the regulation, particularly with over-the-counter drugs. They like the instructions and the warnings to be very detailed, because these are things that just anybody could buy in the store. So it's important to make sure that if somebody is, if one of your patients is using an over-the-counter drug, that they're using it appropriately, and that if something is not getting better, that a physician is consulted with to make sure that the diagnosis is appropriate and that the treatment that is being utilized will be effective. So your antifungals, so the infections caused by molds will all typically respond to the same type of drug. So there's various formulations. They will typically all be pretty beneficial in treating the infection. It's important that you just make sure that you apply it, again, very similar to the dosing with oral antibiotics. If you're using a superficial medication to treat a fungal infection caused by a mold, it will require that it get utilized for a certain amount of time. So you can't just stop using it once it looks like the infection is gone. For instance, with ringworm. If you're using a certain type of medication for ringworm, you have to use it for the entire duration of what's suggested. You can't just look, see that the rash is gone, and then discontinue using it. You have to make sure that you use it all the way through. It's a good idea to wash the area with soap and water before you apply. You usually do 2 daily applications. Again, the skin lesion should clear up relatively quick, but again, you have to continue using it. So with jock itch, athlete's foot, ringworm, you have to make sure that you're using the medication for the appropriate amount of time. And I've noted some time frames on here, but it's always a good idea to make sure that you use it for the amount on the label. And many of your over-the-counter antifungals will be effective on your different forms of ringworm that could be present in the body. Now with vaginal yeast infections, you want to make sure that, first of all, you're aware of the different types of administration of these different types of medications. They come in the form of vaginal suppositories, creams, and even oral tablets. As far as your dosing, your symptoms will usually be treated in 3 days and the infection gone in 7 when using creams. The oral tablet, fluconazole, 150 milligrams, will treat with 1 dose. So depending upon what the individual uses to treat it will kind of dictate how long the treatment has to go on for and how long the symptoms will last. And here are some examples of topical antifungals. So you have your generic name, your brand name would be in parentheses. So Lotrimin, Micatin, and Tinactin are your brand names that you would see, and then you have your generic names next to those. Then you have your non-prescription drugs for yeast infections are on here as well. So again, be able to recognize, you should be able to see one of these names and be able to recognize that it's an antifungal medication when you see it. You should be able to differentiate it between an antibiotic and an antiviral. So our topical antivirals, there's two available that are available by prescription only. The Denavir and Zovirax, which are your brand names or your trade names. Again, they're in parentheses. The generic names are not in parentheses. They're the two available for prescription only, and they're basically available to help shorten the duration of oral herpes infections. And on here we have some just common viral infections that you'll see in athletes, some of which will be used or treated with topical antivirals. Now, dosing with the antiviral topicals, it's going to depend upon which one you're using. So, for instance, the pencyclovir, you look at having to apply every 2 hours. Acyclovir about 4 times a day. When these are being used, they're used to treat oral herpes infections. They need to be started as early as possible to have the best effects. The idea is that it helps to shorten the infection. And with most people that get cold sores, what they'll always say is they'll feel a tingling sensation that occurs just before the outbreak. If they start to apply the medicine at that point, they'll really lessen the infection and will decrease the duration in which the infection is present. And typically all these medications are used for a total of about 4 days. The topical antivirals will really only be effective with oral herpes infections, so they won't be effective against other types of viral infections. A lot of your superficial skin infections caused by viruses, many of them will need oral medications to control. So the oral herpes can be effectively treated with this. Other versions of viral skin infections will typically need oral medications in order to treat them. General considerations for topical medications. So again, with your topical antibiotics, systemic reactions are very rare. Most of the reactions you're going to have to topical antibiotics will just be local, and usually what they'll do is just cause a rash. With antiseptics, you need to be aware that they could irritate the area. A lot of your antiseptics can cause discomfort when applied to a wound. Like, for instance, alcohol is a topical antiseptic, and again, it can kill microorganisms. But if you've ever put alcohol on a skin wound, it hurts. So again, it's usually a good idea, and it's good, evidence in wound care to show that you shouldn't, your antiseptic shouldn't be your first way of cleaning a wound. I mean, if you have absolutely nothing else to clean a wound out with, and it's your last resort, it's fine, but soap and water or sterile saline are both very viable options and also aren't cytotoxic to those beneficial cells of healing. In looking at your topical antifungals, as they relate to, particularly those relate to vaginal infections, the adverse effects are basically the same symptoms related to the infection. So, the itchiness and the discomfort associated with that will usually be what you get out of the topical antifungals in as far as adverse effects. If by some chance the patient complains of abdominal pain, they have a fever, or they have a very foul-smelling discharge with these types of infections, they're not side effects of the meds. There's some other type of condition present. Again, make sure that they see a physician for a definitive diagnosis on what's wrong with them. And you especially have to be mindful of that, particularly the fact now that a lot of the medications that can treat vaginal yeast infections are now available over the counter, which at one time they weren't. So make sure that if any of those symptoms do come about, that they see a physician. And there was mention of this before, but again, in wound care, if you clean a wound appropriately, you don't necessarily need to jump and use an antibiotic cream. So again, I've said it many times over the course of this discussion, you know, soap and water, saline will clean a wound very appropriately, and you won't harm or you won't destroy any of the fibroblasts or the cells that allow for healing to occur, and your wound will heal faster. So you just need to be aware of that. And again, your antiseptics should not be a first line of cleaning wounds, as they'll kill those cells in the wound bed and again delay healing slightly. Just a brief note on tetanus. Your textbook, I don't think, talks about tetanus, but it's important in talking about wounds and making sure that you're treating wounds appropriately. It's good to note this. So none of the medications prescribed will prevent tetanus. So tetanus is a bacterial infection of the CNS that can happen anytime you get a deep wound, particularly those caused by punctures and that are very dirty. Even some very superficial wounds could cause this as well, because all it requires is for the bacteria to get into your system. So you're supposed to get tetanus shots at least every 10 years. Okay, so note that to yourself. Tetanus shot once every 10 years. What's usually suggested, if it's been 5 years since your last tetanus shot and you get a really dirty wound, okay, you know, the classic thing was always you step on a rusty nail, okay, or something of that sort, you should probably get a booster. Okay, so that's within 5 years if it's a really, really dirty wound. Okay, but at the very least, you want to have a tetanus shot at least every 10 years. So if it's been 10 years since your last tetanus shot, you should be going to get a booster. Okay, if you had a shot 6 years ago and you get an extremely bad puncture wound and there's dirt involved and everything else, you should probably get a booster. But you want to make sure that at least every 10 years that you get that. And these are your learning outcomes. So there was a lot discussed in this section. You know, we talked a lot about the different types of infections and the drugs. Again, be able to recognize the different types of drugs, be able to, within, you know, antibiotics, be able to differentiate between penicillins and cephalosporins, and the other types of antibiotics we talked about, and some of the particulars towards them. You know, some of the, you know, again, a lot of the side effects are universal with all of them, but there are some adverse side effects that are particular to certain types. Make sure you're aware of that, and then again, be able to recognize your mechanisms of actions and how the fungal and antiviral drugs are also utilized as well.